So you just got home from the vet for your dog's ear infection. You were told they received something called Mometamax Single, and now you're wondering, okay, what do I do now? What should I expect? And how do I make sure my dog ear heals correctly? Hi, I'm Dr. Peter Mositis from Mermaid Vet Hospital. In just a few minutes, I'm going to walk you through exactly what this treatment is, how to make sure it does its job, and a few simple things you'll want to do at home to help your dog feel better. First things first, your dog's ear infection was already treated while they were at the clinic. While they were there, technicians cleaned the ear to make sure that there was a good surface for the medication to adhere to. The medication was then applied, and there's no drops for you to give at home, which I know can feel like a huge relief. The medication itself has three main ingredients in it: gentamicin, which is a common antibiotic we use to treat ear infections; posaconazole, an antifungal to get rid of yeast; and mometazone, a steroid that helps to reduce redness and inflammation, as well as itch. These three ingredients work together to eliminate the ear infection and reduce your dog's discomfort. One of the most common questions we get in clinic is, how long does this medication last for? A single application of a Mometazone Single will last for over 30 days. This is because it's suspended in a thick gel that's mineral oil based, allowing it to stay on the ear and continue acting long after we've applied it. Historically, the most common reason we had for failure of ear infection treatment was lack of compliance or lack of giving the medication at home. And it's not surprising because giving those drops twice daily for 2 weeks was a huge pain in the butt and very difficult to do with our dog. Having a single dose that we can give in the clinic makes life easier for everybody. Your job in all of this is very important, but thankfully also very simple. While your pet has the medication on board, make sure that they don't receive any baths, and if they go to a groomer, make sure that they're aware that the medication's on board so they don't get the ears wet. We don't want to wash the medication out. We don't want to reduce its efficacy. Make sure your pet doesn't go swimming while the medication's on board. Don't clean the ears, and don't put any other medications in there unless specifically directed by your vet. If your dog continues to scratch at their ears, make sure you let your veterinarian know, as an e-collar might be necessary to stop them from causing self-harm. All right, now for the fun part. What should you expect now that the medication's on board? After initial application, you can expect to see some head shaking or scratching still initially. Getting the medication applied can feel a little bit like a wet willy because of the gel that's going into the ear. Once the medication's settled in, this should go away, and what you should see over the next couple days is a reduction in swelling, reduction in redness, and a reduction in head shaking and scratching. Make sure you call your vet if you don't see a significant improvement in the next 7 to 10 days, or if you notice a new odor or increased discharge. Also call your vet if you notice a new head tilt, wobbling, stumbling, or circling, as this can indicate damage to the inner ear. Lastly, if you're a Mermaid Vet client, keep being awesome, but also make sure that you come back for your recheck. At this point, we're going to repeat the cytology or the examination of the cells in your dog's ear to make sure the medication did its job and the ear infection's cleared. This is incredibly important because if there is a resistant strain of bacteria, this is when we get the chance to catch it. There's no point in doing all this medication if we don't make sure that it worked properly. Ear infections suck and make your dog miserable. But with this medication and some help from you at home, most recover smoothly and don't have any complications. If you're ever unsure about what you're seeing or something just doesn't feel right, make sure you give us a call here at the clinic. We'd rather you ask than worry at home. Thanks for watching, and we hope your dog is feeling better soon.